This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
And we're rolling, baby, rolling. The Berman Method podcast, where we're focused on treating problems and not symptoms. Dr. Jake Berman here, running solo today. What is happening, everybody? We are coming down to crunch time, recording this a good week in advance of our official due date for baby number 2 to arrive. So we're getting excited. A lot of excitement in the Berman household where this could happen any day. Jenni said that the baby's already sitting lower, feeling different, and she's essentially ready to evict this thing. She's not getting any sleep anymore. Can't roll over in bed as easy as she could, have to completely wake up just to roll over in bed. All the ladies out there can sympathize and empathize that have gone through this. And she's just over it. She's done with it. She said that she can deal with the weaker workouts that she has to do now, and she can deal with all the other stuff. But the hardest thing is just not being able to sleep. She's over it. So we are excited. By the time this thing airs, it's very possible that we could have the new addition to the Berman family. So we're super excited. And don't forget, we got our competition going. So go onto our socials and give us your guess. What's the birth date, the birth time, sex, length, weight, bald, not bald. And whoever gets the most right answers is going to get $500 in credit to Berman Inc. And if you get everything right, you're getting $5,000. Man, I must be nuts. Or maybe it's just that hard to get everything right. I don't know. One of the two. But either way, go to our socials, Facebook, Instagram, all of those things. And you should see a post there. Comment on them and let us know what your guess is. Today, what I want to do is I want to go over the most common causes of the most common pains. So the most common cause of the most common pain. So what's the most common cause of back pain? What's the most common cause of shoulder pain, neck pain, knee pain, foot pain, plantar fasciitis, elbow pain, carpal tunnel? And then after that, I want to talk a little bit more. We'll see how much time that takes us. I want to talk a little bit more about unnecessary surgeries. So that's one of our mission, or that's part of our mission statement, is to help as many people as possible avoid needless surgeries while maintaining a high quality of life. So I want to talk a little bit more about what are these needless surgeries and how do you know if it's a warranted surgery or not? How do you know if you need to have the surgery or not? One of the examples I love the most is talking about herniated discs or even rotator cuff tears. So many times people will have surgery on a rotator cuff tear to repair the tear, and you don't need to have the surgery. So I want to talk a little bit more about that. And then I'm going to end with what is the most common cause of getting old. Oh, this is going to be a good one. So without further ado, here we go. This is me being David going against Goliath, where Goliath is the corporate medical system. And I'm saying, take that diagnosis and shove it. We don't care about that diagnosis. We don't care about your intervention because it's focused on the symptoms, not the actual problem that causes the symptoms. So getting right into it, what's the most common cause of neck pain? Poor posture. It's that simple. Don't overthink it. Oh, let me give a little asterisk here. Everything that I'm going to talk about on this episode is for non-traumatic pain. There was no trauma. You weren't in an accident. You didn't slip and fall. There was no trauma. So this is all for non-traumatic. You just woke up one day and it started hurting, or you just twisted a certain way and it's been hurting ever since. This isn't trauma related, so non-traumatic. The most common cause of neck pain is poor posture. It's that simple. The most common cause of shoulder pain, poor posture. The most common cause of back pain, glute weakness. So your butt is too weak to support your back. The most common cause of knee pain, glute weakness. So weak ass syndrome again. The most common cause of foot pain and the most common cause of plantar fasciitis is wearing shoes. And if you want to go into more detail, wearing supportive shoes. The most common cause of foot pain and plantar fasciitis is wearing supportive shoes. The most common cause of elbow pain, poor posture. The most common cause of carpal tunnel, poor posture. Okay, so I ran through all of them real quick. Now I'm going to go back and give some more details on why it is. So let's start at the beginning. Neck pain. Most common cause of neck pain is poor posture. And the reason why is because when your chest drops, so your shoulders are rounded forward, your chest drops, what it does is it makes you hyperextend your neck. So it places you in more extension in your cervical vertebrae, so this, your cervical spine, which really limits your ability to turn left and right. Because when you extend your neck, so think about looking up to the sky, you don't have as much range of motion to turn right and left as you do when you're looking straight ahead. So now you do that with poor posture. You do the same exact thing to your neck as if you were looking up to the sky, the same exact thing occurs when you drop your shoulders and you're in crappy posture. The same result occurs at the neck. So now when you have crappy posture, you have limited range of motion to look right and left. So now when you go to those extreme end ranges, you're trying to check a blind spot, for example, while you're driving, or you're sleeping and you're a stomach sleeper and you've got your head turned one way or another to sleep. Those are end range positions, and you're essentially jamming the joint into itself. So it's bone running into bone, essentially, is what you're doing, because you're going to the end range extreme positions. And it's happening at a micro level, intensity-wise, over a long period of time. And that's ultimately what causes neck pain, poor posture. Now, let's move on to shoulder pain. Same exact cause. Number one cause of shoulder pain, non-traumatic shoulder pain, is poor posture. And the reason why is because you've got roughly 18 to 20 muscles that's main job is to move your shoulder, move your arm. So their job is to support the shoulder blade so that you can move your arm. 18 to 20 muscles that do that. Only 4 of those 18 to 20 muscles are your rotator cuff muscles. And those 4 muscles are typically the smallest out of the 18 to 20. It depends on who you ask, 18 to 20 muscles. When you are in poor posture, it makes it extremely difficult for your body to utilize the 20 muscles to stabilize your shoulder blade so that you can move your shoulder. Your shoulder blade is supposed to be the support system, the base, the foundation for arm mobility. When you're in poor posture, it's really, really hard to use those muscles, almost impossible biomechanically. So when those muscles are not allowed to work, it makes your body rely on utilizing the rotator cuff muscles, these little tiny baby muscles, the rotator cuff muscles, as the primary movers. We don't want the smallest muscles to be the primary movers. You don't want that. That's how you get injured. The same thing, the analogy I use all the time with this is you can pull a boat on a trailer down the road using a car. You can do that. However, if you try to pull a boat on a trailer down the interstate, I-75, using a car, the car is probably going to blow up. You really should be using a truck to pull the boat on the trailer down the interstate because it's just way more work to pull at a higher speed, right? So that makes sense, right? Same thing is true with your shoulder. Your rotator cuffs are synonymous with the car pulling the boat. When you're doing small motions, reaching for a cup of coffee, just small things, typing, getting dressed, those kind of things, your rotator cuff can handle those kind of things. But when something more intense is required of your arm, reaching overhead, catching something that is unexpectedly falling, lifting something, that's synonymous with your car pulling a boat down the interstate. And that's when the rotator cuff says, I don't want to do this. And that's when it starts hurting. So by getting into better posture, it allows those supporting muscles, those 18 muscles, to help support the 4 little tiny baby rotator cuff muscles. So that's why poor posture is the number one cause of non-traumatic shoulder pain. Now, back pain. This is one of my favorite ones because this is the most common thing that we see in the clinic. This is essentially what built my practice, is back pain and becoming really good at fixing back pain. So many people try to overthink it, and we'll get into this in a little more detail later in the episode when we talk about herniated discs. However, everybody likes to think that back pain is coming from your actual spine, your actual back. However, what I can tell you is that 9 out of 10, minimum 9 out of 10, if not 99% of back pain is actually coming from your hip and pelvis combination there and not from the spine at all. So everybody likes to put their hand on their back where their back pain is. And what they don't understand is what they're actually putting their hands on is not your back at all. It's not your spine at all. You're actually putting your hand on your pelvis, more specifically on your sacroiliac joint. This is where your sacrum meets your pelvis, essentially, where it comes together. Okay. So I guess said differently, the sacrum is the base of the spine. It's not your lumbar spine, though. So it's very different from your lumbar spine. It's your sacrum. And that's where the sacrum meets your pelvis. That's that combination of the sacroiliac joint. And dysfunction there is what causes 9 out of 10 symptoms from back pain that people call back pain. And the reason why this occurs is because of weak glutes. The number one cause of back pain is weak glutes. Because if the glutes are not doing their job, then there becomes too much instability of where your pelvis comes into connection with your spine. So there becomes too much motion or instability. And that's ultimately what causes back pain. It's not a herniated disc that causes back pain. And we'll talk more about that here in a minute. So the number one cause of back pain is weak glutes. Okay, moving forward. The number one cause of knee pain is also weak glutes. Who would have thought that weak ass syndrome is what's causing your knee pain? Yes, it is. Remember, the knee joint is one of the most simplest joints in the entire body. It is a hinge joint. It's just like the hinges on a door. You know, it bends and it opens and it closes, opens and it closes. So your knee straightens and it bends, it straightens and it bends. There's tiny bit of rotation that occurs at the knee joint. However, for the purpose of this, we're going to call it insignificant. So let's focus on straightening the knee and bending the knee, just like the door or the hinges on a door. It opens the door and it closes the door. Now, I go into more detail of this in my first book that I wrote, Treating Problems, Not Symptoms, how knees are so much like doors, where you can look at a 120-year-old house, go into a 120-year-old house, and a lot of the doors will make noises when you open them and close them. However, what the noise is coming from is not the hinge itself going bad. It's actually the attachment of the hinge to the door frame and or the attachment of the hinge to the door itself. So that's where the wallering out starts to occur and the screws get loose. And when there's too much motion, just like the sacroiliac joint, that's when noises start to occur. And that's when dysfunction happens. So you have a squeaky door that opens. It's really not the hinge that's going bad. It's the connection of the hinge to the door frame or the connection of the hinge to the door itself. The reason why this is important is because keep the same analogy for your knee. Your knee is the hinge. When the knee starts hurting, it's usually because the attachment is not doing its job and it's above or below the knee, right? So the number one cause of non-traumatic knee pain is problems occurring above the knee or below the knee, aka your hip, pelvis, glute area, or your foot and ankle area. It's the number one cause of knee pain. Hands down, argue with me all you want. I would love it if somebody tried to argue with me on this one. This is one of my favorite ones of all time. So the number one cause of knee pain is glute weakness. You gotta have support above it, because if you don't have support above it, then the knee is going to take the blunt of the torque, the trauma, whatever you want to call it, with walking, stairs, getting up and down from the ground, whatever it is. You don't want the knee taking the blunt of the force. The main purpose of the glutes in relation to the knee is to help unload the knee joint. So when the glutes are doing their job, they actually help unload the knee joint. That takes the stress off the joint itself. More on this later. Okay. Next one, foot pain and plantar fasciitis. I love this. I think I've got 15 episodes on this subject alone out of the 80 that we've recorded so far on this podcast series. The number one cause of foot pain and plantar fasciitis is wearing supportive shoes. It's that simple. Think of it this way. You've got a minimum of 16 muscles that are supposed to support your foot. There's 16 muscles in the arch of your foot alone. There's over 100 muscles, tendons, and ligaments in the foot alone. When you put a shoe on, specifically a supportive shoe, those 16 muscles in the arch of your foot, they don't have to work anymore because your supportive shoe is now doing the job. And this is all fine if you plan on wearing the supportive shoe every single time you stand on your foot. The problem is we don't. Life occurs. You walk to the bathroom in the middle of the night without the supportive shoe. You go on a trip and you don't bring the supportive shoes, or you have to go to a dance or some type of formal event, and you have to put your feet in these horrendous high heels or just something different. So you're not always wearing those supportive shoes, and that's when the foot freaks out because it doesn't work anymore, because it hasn't had to work. You don't use it, you lose it. So those muscles atrophy and they get weaker and they can't support the foot anymore when you force it to, when you're not wearing the supportive shoe. So the number one cause of foot pain and plantar fasciitis is shoes, specifically supportive shoes. That's why I never wear shoes in my office, ever. And it's concrete floors. There's so many people that cringe when they hear that. They're like, I could never walk on concrete all day. My feet would be killing me. Well, that's why I do it. So my feet are not killing me. Think about it. Okay, elbow pain, poor posture. It's that simple. Now, I elaborate more on this in my book. I'm just, for time's sakes, I'm going to try to breeze through this real quick. When you're in poor posture, you're compressing a nerve that comes out of your neck that runs all the way down to your fingertips. And imagine that nerve as a water hose. You turn the water hose on, the water comes out just fine. You go step on the water hose, the water still comes out, but not as good, right? That's what happens when you have poor posture. That nerve that comes out of your neck gets kinked. You put in little pressure on the water hose, so you're kinking that nerve, and that's the nerve that comes down and gives you strength to your muscles in your forearm and your hands. When you can't get enough flow to those muscles, then those muscles get overworked and underpaid, and they can't do their job anymore. When the muscles can't do their job, the joint has to do their job. And that's why the elbow starts to flare up, because it's not getting the proper support from the muscles. I'm not going to go into detail because we can go in a rabbit hole with that one, but just trust me, that's what's causing it. Carpal tunnel, same thing, poor posture. The number one, or the majority of people who complain about carpal tunnel syndrome are the ones that are at a computer all day long. When you're at a computer, you're not in good posture. I'm not going to go into more detail on that because it's the same exact concept of the elbow pain. Okay, let's switch gears a little bit into unnecessary surgeries. This is what makes my blood curdle. This is what we wanted to start this podcast for. This is David going against Goliath right now, where I do not believe Western medicine has your best interests in mind. They're treating symptoms, not the problem. So lumbar herniated disc. So many people have surgery on a lumbar herniated disc. So a herniated disc in your low back, a bulging disc, a slip disc, whatever you want to call it, in your low back, because they're in excruciating pain. There's one reason and one reason only to have this surgery. It's because you do not have any position of relief. So if that nerve is constantly being compressed and there is not a single position of relief, then yes, you have to have the surgery. However, it is so rare that somebody tells me this that has had this surgery that it's untrue. I mean, it just blows my mind. So when you have back pain and your MRI says you have herniated disc, it doesn't mean that the herniated disc is causing your back pain. And I've referenced this study so many times, and it's not one study, it's multiple studies where they have looked at asymptomatic people. So people that do not have back pain over the age of 40 years old that don't have back pain. And this is thousands of people that have gone through this study. And they've given these people who don't have back pain, who are over the age of 40, an MRI. 60% of those people came back with some type of herniation or bulging or compression in their lumbar spine. 60%. That is ridiculous. And these people don't have any back pain. So that is why you cannot say a herniated disc causes back pain. You can't do it. You can say it might correlate with it. However, it has to match the symptoms. So you cannot say a herniated disc causes back pain because there's been multiple studies that have proven it false. So please listen to this. I don't care what your MRI says. What I do care about is what your body says. So we've got to go through an objective series of tests. And if those objective tests match what your MRI says, then okay, I'll entertain the thought that this herniation is causing your symptoms. Even then, we're still going to try to find a position of relief. If we can find a position of relief, then it's highly likely that we'll be able to avoid surgery. If we can't find a position of relief, then that's probably not likely. Might as well go ahead and have it done or strongly consider it. Same thing is true for a cervical herniated disc, so a herniated disc in your neck. The number one cause of cervical herniated discs is bad posture. Oh, I didn't say the cause of lumbar herniated disc. Guess what it is? Weak glutes, weak core. Because you're not using your glutes and your core to do bending, lifting, twisting, you're putting too much stress on the lumbar spine, and that's what causes the herniation to begin with. So you can go in and have the herniation surgery to, clean it up. However, if you don't fix the reason why it happened in the first place, aka strengthen your glutes and your core, it's gonna happen again. So back to cervical. So herniated disc in your neck. Number one cause of it, poor posture. It's that simple. So again, you can go and you can have surgery on that herniated disc. However, if you don't fix the reason why it happened in the first place, chances are it's going to happen again at the segment above or below that you had surgery. And I see this so many times. Bone on bone knees. I love this one. My orthopedic doctor says I have bone on bone, so I have to have a knee replacement. No, that's not true. What caused the bone on bone to begin with? Weak glutes. We already talked about this. So you can go have a knee replacement. However, if you don't fix the reason why you had to have it in the first place, your knee is still going to be in pain after surgery. And I see this so many times where people are frustrated off all end for months and even years sometimes after a knee replacement, because the reason why they had a knee replacement because their knee hurt, and then they had the knee replacement and their knee is still in pain. So frustrating for so many people. It's because you never fixed the reason why it was hurting in the first place. Weak glutes. Oh, here we go. Two more things and we're going to wrap things up. Rotator cuff surgery. One of the reasons why I wanted to talk about this today was because this just happened. One of my former clients that I worked with years ago, his shoulder started bothering him. So he came back to see us. And it was clicking. The MRI said there was a tear. And he's like, yeah, they told me I had to have surgery. Not looking forward to it. He's a big time golfer. And the surgery wasn't scheduled until like 8 or 10 weeks because that was as soon as they could get him in. I said, okay, well, why don't you just come in here and see if we can help you out before surgery? So I'm not trying to prevent it. If you have to have it, you have to have it. But why don't you just come in here and do some prehab? Let's do some strengthening that leads up to the surgery so you can recover much quicker. In my mind, I knew what I was doing. I was like, I'm going to prevent this guy's surgery. He doesn't need surgery because I did a couple of tests. I'm like, he doesn't need surgery. There's 20 other muscles here that can help support it. So long story short, not even long story, 4 weeks into him coming here, he's like, I can't believe how much better it feels. 6 weeks into it, he's like, I'm not having the surgery, not having it. So he goes to his follow-up appointment with his surgeon. So this is before the surgery, still before the scheduled surgery date. And he tells his surgeon, he goes, well, this is what I've been doing. I've been going to PT and I don't have any issues anymore. His surgeon goes, well, you should still have the surgery because it's probably going to get worse. And if you wait to get it done later, chances are I won't be able to save the rotator cuff and you'll have to have a total shoulder replacement. I almost threw up when he told me that his surgeon said this because it's a very well-known surgeon. I've known him. I know of his name. I don't know him personally, but I know his name. He's a very well-known surgeon. And I'm not trying to do this to talk crap about another professional. What I am trying to do, though, is I'm trying to say you need to question everything. That's all I'm trying to say. I'm not saying that I'm right and he's wrong or he's right and I'm wrong. What I am saying is you need to question it because sometimes there's ulterior motives. That's all I'm going to say about that is sometimes there's ulterior motives. Now, what I'll tell you from an objective standpoint is if this guy's getting better objectively and subjectively, the only reason why he would ever have to have surgery in the future is because of a trauma. He slipped and falls. He's in a car accident or he falls off a bike. Now, if that happens, it's going to be irrelevant if he had the surgery anyways, because it's a trauma. Traumas don't care if you did prehab, rehab, you had surgery, you didn't have surgery. It's going to tear something anyways. So the point of this is just because you were told to do something by a well-respected orthopedic surgeon doesn't mean that it's the right answer. So this is me being pissed off and just taking the gloves off and going all out because, I try to be professional as much as I possibly can. And I've never tried to go on record and talk crap about somebody, but this just pissed me off. This surgeon told him he should have surgery anyways, because if he doesn't, he's going to have a reverse shoulder or a shoulder replacement. I'm like, what are you effing kidding me? He's doing everything he wants right now. His posture is so much better now. His shoulder's so much stronger now. Get the F out of here. Come on, man. Okay, last thing I'm going to leave you with. The number one cause of getting old is quitting. The number one cause of getting old is quitting. Think about it. We always say, man, I'm getting old, when you go try to do something that you haven't done in a long time before. You go to get down on the ground and get back up again, and it's really hard. It's like, oh man, I'm getting old. Well, when's the last time you tried to do it? Most people say years. It's been years since I tried to do this one thing. And now all of a sudden you try to do it again and you can't do it, or it's not as easy. And you're like, oh, I'm getting old. So the number one cause of getting old is quitting. So my advice to you is quit being a quitter. Keep doing everything that you want to do, because you have to imagine yourself 5 or 10 years from now. 5 or 10 years from now, what do you want life to look like? If you want to be able to get down on the ground and get back up again quickly, you better be doing it today. If you want to be able to do a backflip, you better be doing it today, because you're not going to be doing it 10 years from now. Whatever it is, you better be doing it today, because it's not going to magically just stay there. You're not going to magically be able to keep the ability to do it. So the number one cause of getting old is quitting. You're quitting exercise, and you're quitting working out as hard as you used to, or as intense as you used to. You're quitting gardening or being as active as you used to. Whatever it is, you're using your arms to get out of a chair more often. Whatever. Quit being a quitter. So that's all I got for you today. Thank you so much for listening. Share this podcast with somebody you know, because I know that you know somebody that this is directly important for. So share this podcast. Let's blow this thing up. David against Goliath. Ask questions. Even ask me questions. Question me. And if it doesn't make sense, go somewhere else. All right. Till next time.
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.